Concern over the Omicron variant of the coronavirus, which is leading to new travel restrictions, including for U.S. citizens. Our lead national correspondent, David Begnaud, is at JFK Airport in New York with more on that. And he's also got an inside look on how scientists are working to understand this new strain. David, good morning.
Nate, good morning. The CDC is going to be increasing testing surveillance at the arrivals terminals for four of the nation's busiest airports. We're talking Atlanta, San Francisco, Newark, and John F. Kennedy, where we are this morning here in New York City. Also, within the next 24 hours, we expect an announcement that's going to affect just about anybody traveling to the U.S. Late last night, the CDC confirmed they are working to modify the testing requirements for travel into the United States. Right now, travelers have to be tested within 72 hours of departing to go to the United States. But the White House may soon announce that travelers be tested one day before boarding flights, regardless of their vaccination status or the state of COVID in the country that they're coming from. In the U.S., the message is consistent. Get vaccinated, get your booster, do it now.
We have far more tools to fight the variant today than we had at this time last year.
One of those tools could be the at-home pill from Merck. That would fight the worst symptoms of the virus and lower hospitalizations and deaths. An FDA advisory panel on Tuesday recommended its use. It is now up to the FDA to sign off. Meanwhile, there are labs around the U.S. testing right now to see where Omicron will pop up first.
We're sequencing the COVID genome of thousands of positive COVID samples.
We went to the Pandemic Response Lab, which is just outside New York City, to meet John Laurent. He is head of research and development here. The U.S. is sequencing 80,000 positive PCR tests every week to look for variants. That way, they can determine how fast the variants are spreading and how infectious they are. About 2,000 of those sequences occur right here.
Our turnaround time here, once we get a sample in, is about 3 days.
Right now, it is the Delta variant that makes up about 99% of the cases worldwide.
How long did it take for Delta to become the majority of all COVID-positive patients in New York City?
Thinking back on that, I think it was probably 6 to 8 weeks from the time we first sort of saw it and then really saw it take off. And it took off very quickly.
That's pretty fast.
Yes. It was very fast.
So is it your guess that once you detect Omicron, within, let's say, a month and a half to 2 months, it could be the majority of everything?
It could definitely be.
Think about that. One more thing before we go. Just to our north in Canada, a negative test is no longer a substitute. As of now, if you're 12 and older and you're not vaccinated, they won't let you travel by plane or train. Gayle?
All right, David, so many people working so hard to keep us safe. All we have to do is do our part. Thank you very much, David Begnaud reporting.